by Alana Karate. To begin, many people do not understand how much addiction affects people in the United States each year. They believe only if you are in poverty, you become addicted to drugs. But do you know the warning signs? Addiction can sneak up on a person. There's a fine line between the user, the drug, and who actually has the control. There are many symptoms of addiction, and some include continuous intake of substances, stashes, consuming the substance in excess, and being in denial about having a problem. Not one group of people is affected by addiction. It is widespread and touches lives in a specific way. As a case manager, it is our job to break the stigma of addiction. For example, if someone is addicted to cocaine, it inhibits the refilling of one's dopamine receptors. After a long-term drug abuse, imagine the effects on one's brain. With drug abuse come serious consequences. The sooner people are educated on the fact, the more prevention will occur. Education is key. When entering substance abuse counseling programs, there are many factors working against the future case manager's clients. Even before treatment, those who are addicted must desire to change. Therefore, they check themselves into many rehabilitation programs. The first step. For many clients, this realization comes from family members or the law. Either way, the road to lifelong recovery is a process from abstinence of drugs. Those who are afflicted with addiction have less control in their brain chemistry, and many clients seem to lie to get what they want, but the case manager must realize their interviewing skills at this point. Clients are already apprehensive when working with a service coordinator, so the case manager must be aware of the differences they face. Cultural, ethnicity, religion, and socioeconomic class are some contributing factors. As service coordinators, our job is to advocate for the clients and to maintain professional relationships by creating and achieving goals. Many addicts do not know how to keep healthy relationships in their lives. The relationships they have up until this point are dysfunctional. When you are addicted, your friends are addicted to drugs. When you are addicted, trying to regain control of your life becomes difficult because those relationships are built off of drugs. This hinders the chance of a successful recovery. The case manager and client relationship is a strong factor in helping the client understand what healthy communication is. The relationship is strictly professional, but within that service coordinator-client relationship, the addicted can help seek out the support of the family and learn healthy coping skills. A form of long-term treatment is family therapy with addicted family members instead of outpatient support. For example, if a case manager is dealing with a client who is a child of an alcoholic and feels that is the reason for their substance abuse, then sending them to the proper support group is key to a successful recovery. ACA, Adult Children of Alcoholics, is a program geared towards the treatment of adult children of alcoholics and is located worldwide. The case manager would set up the client meetings, help them get their foot in the door of their new life. This beginning process for the client is scary, but good. As a social worker in the NASW Code of Ethics, those are our guidelines when dealing with ethical issues. Dilemmas when working with the addicted population vary from individual to societal level, ranging from case managers' personal beliefs or societal judgments on the client. It is key to keep in mind the stigma associated with getting treatment. The case manager and client must work together in the relationship to see results. Confidentiality is a key ethical issue when working with the addicted. In the general practice of social work, the dilemma of confidentiality affects everyone involved. As a mandated reporter, social workers must report any form of abuse. The clients have been informed about the dilemma of confidentiality. It is between the two, except if there is harm to the client, another party, or understanding of abuse. Competence of the client is necessary for when making treatment decisions. If the case manager does not feel that the client is making healthy lifestyle choices for themselves, then the question of competence arises, and the necessary steps will be put into place. Values of the case manager and client are going to conflict. A good case manager remains neutral, creating and maintaining goals for the client, although they might not agree. Case managers must rely on the NASW Code of Ethics. Here, there are guidelines social workers nationwide can follow for when dealing with ethical issues. Challenges. There are many challenges associated with working with special populations, especially those addicted. Case managers must evaluate the challenges and the needs for their clients and understand what resources they require for successful treatment. They must understand how much they cost, how they are financed, if under insurance, and how people get into those programs. Support comes from the family, and service coordinators know that. When working with the addicted, it is key to include family members in specific group sessions so they work together to overcome past issues. Once the client and case managers have established a solid relationship goal, they will usually take a step back from the family and maintain a support group. Advocacy is the root of a successful case management. This tool will always be used when you're working with any population. Addicts get looked at by society as degenerates who are addicted, and case managers see someone who wants to regain control of their life. The case managers look for resources for the client, such as fair housing, proper insurance coverage. Housing can be a problem as well as insurance. Being able to get clients insured is a big step because insurance companies are non-compliant due to past drug abuse. This can get your client discouraged. As a case manager, we must remember how brave the clients are for taking the steps towards recovery. We must not let insurance companies belittle you and your community-based agency helping people with substance abuse. Being an advocate is a life skill, and case managers should do for the clients always. So what can you do? People who are not social workers and in the profession feel as though they are on the outside looking in. There is such a strong connection between social workers nationally and our call to help others. You can be a part of it too. In your local community, there can be so much done and advocated for. Just have to look for it. Case managers every day are fighting for the rights of oppressed individuals. You have to stand up against the grain of society and believe in the worth of people and in social justice within our communities. If you think you have what it takes to be a real-life superhero, get involved with your local community, find out where the need is, and be the change you want to see in the world. Thank you.